everybody, and thank you for this opportunity to share our story at this Healthcare and Life Sciences Symposium. My name is Kyle Eckhardt. I'm the Director of Special Projects with Lower Mainland Medical Imaging in the province of British Columbia. Also presenting with me today is Dr. William Parker from the Radiology Department. He's also the Chief Executive Officer of Sapien ML. Just an overview of our session today. We'll be telling you a little bit about us, our industry challenge to the Amazon Cloud Innovation Center, the overview of the solution and some of the architecture associated with that, and then we'll talk about how this is going to transform our business processes and close off with some of the benefits that we feel that we've received by partnering with AWS. So Lower Mainland Medical Imaging is a consolidated service that provides medical imaging exams across 29 facilities in 4 different health authorities in the Lower Mainland of British Columbia. We have about 1,500 staff, and we perform 2 million exams a year across 12 different imaging modalities. About 170,000 of those exams are MRIs. Sapien ML is a company that we've partnered with for this Cloud Innovation Center project, and they specialize in machine learning and natural language processing. We also have the benefit of partnering with the province's Provincial Health Services Information Technology Group, and they support us with project management resourcing and in technology-based support. So just want to run through a little bit of the challenge that we brought to the Cloud Innovation Center. We have inserted a central distribution hub for MRIs that we call MRI Central Intake. What this hub allows us to do is it allows us to smooth requisitions by choosing what sites they get distributed to across our Lower Mainland service. The challenge that it introduces, though, is that it's an additional step in the process, and it's very, very process heavy, very people heavy, and so thus it delays the time that a requisition takes to arrive at a facility. You can see downstream, once the requisition arrives at the facility, there is another triaging process that takes place where the exam's priority, its protocol, which is the sequence of images are assigned, and the duration of the exam is recorded. All of this takes place before a requisition is actually scheduled and a patient is notified of that they have an imaging appointment. Another challenge that Lower Mainland Medical Imaging faces is that our Ministry of Health is requesting us to expand the central intake services to include computerized tomography, ultrasound, echocardiography, and mammography. Combined, this would increase our requisition allocation from 170,000 to over 1 million. Our current central intake model is very costly in terms of we have 7.8 full-time employees transcribing 10,000 requisitions a month. If we were to add another modality like ultrasound or CT, that would require us to expand that staffing allocation by 13 full-time employees for each modality. Combined with office space, challenges around recruiting, the situation is untenable and not scalable. Further, the triaging process that takes place at the facilities is also very paper-based and labor-intensive right now. Radiologists, technologists, and clerk are all involved in reviewing, printing, commenting, transporting requisitions before an order can even be scheduled. Finally, the crux of the matter is the exam priority is something that is not determined until the requisition arrives at the facility. Will is going to discuss with us how our approach to predict the exam priority through the AWS Cloud Innovation Center project will help transform our process. Will, over to you.
Thanks, Kyle. So again, I'm Dr. Will Parker. I work in radiology and CEO of Sapien ML, and I can't tell you how excited I am to share what we've done with this project. You know, from a data science perspective, it is such a dream to be able to work on such amazing data and to help the healthcare system in such an interesting way. So moving into kind of a bit more detail on the problem, and I'll go through this quickly and then we'll get into the exciting solution that we've developed. So on this slide here, we have the family physician or the doctor sending in that piece of paper, that requisition to central intake, requesting an MRI. And on that requisition, those priority values that you see on the screen are actually not there, and they're not determined there. But we need to identify how quickly this MRI is to be completed. Does it need to be done tomorrow because this is a life-threatening situation, or can it wait, upwards of a few months, even to the end of the year sometimes, because it's just it's a query that the patient's concerned about, but it's not urgent. So these, once central intake gets it, it decides based on some business rules where the requisition should go to. I've given some examples here of the Lower Mainland. There's Vancouver General Hospital, UBC Hospital, or Richmond Hospital. And then it gets to the site and the radiologist puts that p-value on it, also decides whether or not it needs contrast and a few other details about how to complete the MRI study. Okay, so now let's get into the specifics of how these p-values work. Let's say a requisition gets sent to UBC and initially gets assigned a P2 value. That's a less than 1 week wait list time. And that's looking across the board. That's a very good wait list for a P2 value. It's actually the lowest wait list. But let's say, for example, another requisition comes in and it's determined to be a P4 at UBC. Well, unfortunately, UBC is not the best site for that P4 value. Actually, it would be, in this example, Vancouver General Hospital. And this, as you can imagine, when you have 170,000 requisitions, this is happening all the time across all of the different MRI sites. And it becomes quite a complicated problem to solve. And we decided to apply machine learning as well as the back end of AWS to help us solve this problem. So we initially discussed the problem with the UBC KIC office, which is partnered with AWS, and we worked out the problem and decided to use some of Sapien ML's technology for data management with AWS and their backend with natural language processing, Comprehend, and Comprehend Medical. We determined that we needed to create a predictive model for predicting the MRI exam priority. And we also needed to decide whether or not the study needed contrast at that central Lower Mainland medical imaging office, because that would also help better identify a site that would best manage that MRI request. And then we developed and tested the system within a controlled environment at UBC CIC with anonymized data that was prepared by Sapien ML, and developed it out to the point where it was ready to be then shared and implemented in the landing zone at Lower Mainland Medical Imaging and the province of British Columbia. So at this point, we have created an open source tool that we have posted on the UBC CIC website. And you can go to the site. I'll share the website link on one of the following slides, where you can actually see a bit more detail about the process to which we developed the tool. And you can get a link to our GitHub account where you can actually download the software and install it at your institution or your organization and try it out. The architecture of the solution is shown here, and it's relatively straightforward, but I'll go into some of the details so at least you kind of, before getting started with installing it and working with it, you have an idea of what you're getting into. What happens is that a requisition, which is initially potentially in a PDF form, or potentially it's in a digital format, gets ingested into the AWS cloud environment. And the data is then parsed, and it is sent to 2 different locations within the architecture. So first it's sent to, if it's just tabular data, it's sent to the Postgres SQL database. And if it's free text, it's sent to the AWS Comprehend and AWS Comprehend Medical. AWS Comprehend Medical extracts meaning from that free language text that's in the requisition and pulls out keywords that are important for determining whether or not what is needed for the MRI request. Then that is all processed, and that tabular data that's extracted from the free text language data that was extracted by the NLP, the Comprehend Medical, is then also ingested into the Postgres SQL database. Postgres uses a bit more of it's not a simple database, it uses a bit more of an advanced a weighting system on the back end. Lets the system add weights to words, keywords, synonyms, antonyms, so that when it's being matched to the NLP output, we can get a better matching from all the different tabular data that's now been stored to those priority values and those contrast outputs. We also have built into this a thesaurus. Medical language is quite complicated. There's lots of strange, weird, and wonderful words that are used to describe different illnesses and different processes in medicine. And so having that thesaurus that we can constantly improve upon and input different words is a powerful added feature to this piece of software that we've developed. All of this is stored, all of the database backend is stored in S3. There's a front end as well that's using AWS Amplify, and that's allowing the administrative staff at Lower Mainland Medical Imaging to log in, see what the outputs are from the system, as well as it adjusts those database attributes such as the thesaurus entries and whatnot. A lot more detail is about this architecture is on the UBC KIC website, as well as our GitHub, and so I would highly recommend visiting the site to get more information if you're interested. This is what the front end looks like. It has a form that you can submit manually and test the different types of requisitions that might be coming into your site. Here is just a standard requisition for an arthrogram of the shoulder. Has a bit of a description that's usually present for someone who's having some pain from potentially a slap tear, which is a type of tear of the labrum of the shoulder. And then the system has outputted a p-value, a P3 in this case, and says that we do not need IV contrast. So one more slide for me. It was such an exciting process working with AWS, UBC KIC. AWS has an amazing culture that uses this process that I wasn't aware of previously, but was sure appreciative learning about after the fact, which is working backwards, where you actually start with the end user, the customer, create a press release, and then break it down into all of its parts by tearing apart that press release, asking those questions, and then getting started on developing the technology. And it was an exciting process. It was great to work with AWS, and it sure is fun to now see the results. So thank you very much for having me.
Thanks, Will. And so in terms of the outcomes and our next results on this, I think it's obvious now that establishing the exam priority is a critical piece of infrastructure that we will require in order to automate the MRI central intake process. I'm happy to report that the prototype of the solution has been loaded into our landing zone within our information technology group, and Will and his team are working on preparing it for production readiness. Right now we're at about, just with the pilot project itself, we were about 80% ready for production. This solution, combined with several other initiatives such as electronic requisitions, evidence-based guidelines around determining priority, will really help us transform the solution and our central intake model and build something that is scalable and growable to accommodate other modalities. It also gives us the opportunity to expand the prioritization tool that we've developed with AWS and the Cloud Innovation Center to provide similar prioritization for all of these other guidelines, or for all of these other modalities. Some of the benefits that we've had in terms of partnering with AWS, as an engineer, I always appreciate new approaches to problem solving, and the working backwards approach really helped get to the core of the problem that we were trying to solve and committed us to the process. It helped us speed the development and iterations, and it's really just been a pleasure to work with such a capable team. We've also been able to determine that the Comprehend and Comprehend Medicals have very affordable fee structures, and that we're certainly looking forward to onboarding those to augment our current capabilities. So with all that, I'd like to thank you for your time and your attention, and enjoy the rest of the event. Thank you.